Good evening and thanks for staying tuned. Welcome to our special program on COVID-19. I am Ladi Akeredoluale. Here are the highlights. Case load on coronavirus leads to 65 confirmed cases just before we came on the air. Justice Presidency explains the president's policy on COVID-19, says his decision not to take up daily briefings of Nigerians is a matter of style and no harm is intended. Sadly, Imo State records a second COVID-19 case. The patients were said to have been in contact with the first case, the governor. And Ugandan authorities go tough on enforcement over COVID-19. We'll begin with breaking a story. Nigeria now has 65 confirmed cases of the coronavirus or COVID-19. 14 new cases have been confirmed, 2 in the FCT, that's the Federal Capital Territory, and 12 in Lagos. Of the 14 new cases, 6 were detected on a vessel, 3 are returning travelers into Nigeria, and 1 is a close contact of a confirmed case. As at 7:35 this evening, that's 26th of March, there were 65 confirmed cases. 3 of them have been discharged, and 1 has unfortunately led to a death. Meanwhile, the Minister of Health, Dr. Osagie Ehanire, has confirmed that indeed an aide to President Muhammadu Buhari tested positive to COVID-19 and is being treated at one of the facilities in the country. But he did not disclose the identity of the patient. Dr. Ehanire was speaking at a news conference in the nation's capital, Abuja, days after the news went viral that a chief of staff to the president may have tested positive. Aside the confirmation, the minister also warned against self-medication and also cautioned against the use of chloroquine.
Who tested positive is receiving treatment in a secure facility. He does not need category 4 treatment. He requires only a general medical treatment. The contact tracing has been very efficiently done, and I'll use the opportunity to also tell you that there are what you call close contacts, and there's also what you call casual contact, and there's what you call distant contact. Distant contact is a no contact. Like this gentleman, like you and me now, is like no contact. Okay? Okay, there's casual contact that maybe you shook hands. And then there's close contact when you sat together head to head and had a conversation or a long conversation or whatever. So you differentiate between those ones. So if you're looking at the casual contact and also the distant contact, if you call it that way, maybe we just see each other from a distance, those ones are not critical. So those contacts have been done and the tests have been carried out. We use a test kit that is sanctioned, approved, and in fact, to a large extent, supplied by the World Health Organization. So it's approved, and we insist on that. There are many, many, many vendors who are offering us test kit from here, from left, from right. We use WHO accredited test kit because the result you get has to be reliable, and it has to be dependable. It has to meet all the criteria for protecting our citizens. So there are people who are developing what they call rapid test kit. And the rapid test kit, they are testing other parameters. And those are the ones that are said not to be reliable, those ones. But we don't use that one here. We're not using those rapid test kits. So some of those rapid test kits are said to be unreliable, and they have not been verified by the World Health Organization. They have not been validated until they are valid. In fact, the manufacturers will tell you, when you use this rapid test kit, go and do the real test to confirm. So why do double test when one is not reliable?
The Minister of Health, Osagie Ehanire, who also did say that he would need the consent of that aide to the president to reveal his identity and location. Now, for those who have been wondering why the president is not the one briefing the nation on the COVID-19 situation, here's an explanation for you. The special advisor to the president of media and publicity, Femi Adesina, says it's a matter of style and there's no harm intended. Mr. Additional made the clarification today on our program, Politics Today.
Of style. If we go back to school, you remember in stylistics class, we were told that style is idiosyncratic, which means it differs from person to person. The style that A adopts may not be the one that B adopts, and there is no style that you can call the style for everybody. So everybody is at liberty to adopt a style that suits him.
Right.
The style our president has adopted is to set up a presidential task force headed by the secretary to the government of the federation, which briefs regularly. You have the health minister, who briefs. You have the Minister of State Health, who also briefs. You have the NCDC, National Center for Disease Control, they brief.
You know,
so
Mr. Additional,
have that change.
A moment,
and
that's understandable.
There is no lack of information.
Special Advisor to the President on Media and Publicity, Femi Additional. Meanwhile, the federal government says it is coming out with tough measures to contain the spread of COVID-19 in the country, one of which is stopping interstate travels. Though this is coming from the Minister of Information and Culture, Mr. Lai Mohammed, who told journalists in Abuja that many Nigerians are not cooperating with the government with regards to the social distancing order. The minister also raised the alarm of looming community spread of COVID-19 in the country, saying if this happens, the rise in cases would be exponential. In Imo State, the health authorities have confirmed an additional case of COVID-19. This second case is a 62-year-old male and a close friend of the governor, Bala Mohammed, who had earlier tested positive. The Commissioner of Health, Dr. Aliyu Megoro, says of the 48 samples taken, 2 have been confirmed positive, 37 have returned negative, while the results of 9 samples are still pending. Contact tracing from the second case has in fact commenced. Imo State now has 2 confirmed cases, the first one being the governor of the state himself. And now we can actually cross over to our Abuja studios, where our correspondent Kayla Megwa joins me. I'm wondering if we can see Kayla there now. Yes, there she is. Hi, Kayla. What is the situation today? Yesterday, you reported that the compliance levels were low. Has it changed today?
Good evening, Laddie. Unfortunately, it hasn't changed much. Took a drive around the nation's capital today and still seeing so many non-essential staff outside, just doing what they want to do, going around and living their lives. Now, I think maybe the reality of the situation hasn't hit properly in the nation's capital. Even this afternoon, we literally had to drive around and be asking people, why are you outside? Where are you going to? What do you do? Are you a doctor? Are you a nurse? Are you providing essential services? And with every question, so I was saying, no, I'm just closing from work. I'm like, so that means that there are some offices that do not provide essential services that are still open right now. And that is something that needs to be addressed in the nation's capital. Also, the rules on social distancing, more needs to be done. More people in the nation's capital need to understand why this is important in flattening the curve. We have 2 more cases now of COVID-19 in the nation's capital, bringing the number to 12 in Abuja. Now, it may seem like a little number, but the way it multiplies, of course, we've been educating about that. And I think maybe many people need to understand how this can actually get bad. So to your question, the compliance level, a little better than yesterday, but still saw so many people outside who are not providing essential services, and so many businesses still open, Mr. Laddie.
Now, if one is to take a deeper look at this and find out, did they give you, some of those you spoke to, did they give you any kind of reason why they're out, or is it that they don't know that they're not supposed to be out?
So yes, talking to them today, let's see, there was a person at Apo. I stopped along the road. I was driving and I just kept looking at this person, and I stopped and I said, excuse me, are you providing an essential service? Are you a doctor? Are you a nurse? And he was smiling while I was talking to him. And I said, I'm serious, I want to know. And he said, oh no, I'm just, my house is just down the road. I just said, let me see somebody off. And I said, why? Why are you outside? This is a time for us to lock down. It's not because you're not liked. You're not told not to go outside because people don't want you outside and they don't like you. You're told to stay inside so that you do not be a means of transmission or get infected yourself. You know, so many people, like I said earlier, probably haven't understood or haven't come to terms, I think maybe that's the word to use, they haven't come to terms with the reality of the situation and how bad it can go. I think many people that I spoke to today have a tendency to think that, you know, everything is in God's hands, which is true, but you do have to be careful, and that's an education I think that needs to spread around the nation's capital. It is very scary when you think about countries that have had to deal with not doing the right thing at the right time. Look at Italy and what they're going through right now. And they even have better health facilities than we do here in Nigeria. So imagine if that hits us. You know, so the reality of that, I think, is something that many people in the nation's capital need to understand and take drastic action. Also, to address businesses that are not providing essential services that are still open, that also needs to be looked at. We're seeing the update where Mr. Lai Mohammed says the federal government might be banning interstate travel. Just before we came on with you, we were talking about a few people who said they had to travel from Kano to Abuja. Someone wants to go from this place to that place for nothing essential. Just, I have to go be with friends, or someone is getting married, I have to go. So banning interstate travel probably will go a long way in helping people do the right thing at this time, Mr. Ladi.
A comprehensive brief there. Thank you so much, Kayla, for that. But we're looking forward to better news tomorrow, definitely out of the FCT. Thank you so much, Kayla Maguire, correspondent in Abuja. Now, in Lagos, the State Commissioner of Police, Imo State, has been going round to enforce the directive on movement and the prevention of COVID-19. The police boss explains that the level of compliance is satisfactory in all the areas visited.
For the past 3-4 hours, we've been going around Lagos. We started right from Ikeja, and we're ending up in Ikeja, so moving. We visited some eateries. We've seen that eateries were not closed. We've seen that they have observed that social distance. They have equally observed that number of maximum of 25. We've equally gone to pharmaceutical shops. So that we've seen that they are attending to their customers without any hindrance. We've equally visited some banks to make sure that even those that are making use of the facilities of ATM, they have that distance, and even the hall. So the banking hall now, so where we visited, so they maintain that social distance with the number. And equally now, we've moved to the markets. We've gone to Lagos Island. We've seen that the whole Lagos Island, the Dumont, Dumago, so it's total shutdown in self-compliance. One thing is that we did not force them to comply. Even Tejojo Market, we got to Tejojo Market now, the place is called locked down, the gates were locked. From there now we decided to move to my two, which we know is traditional food store market. And we all saw what happened there. Supermarket were visited in the Ikeja, maybe about no supermarket, we realized that. So everything there was peaceful. So no supermarket disturbed. And let us go more to a more scientific one, that is ShopRite. You've seen most of them, even the areas that are not having food stops, that are not having pharmaceuticals now, their shops, they close their shops in compliance with the directives. So Computer Village will know this place, nobody can move freely when it is in session. So we are appreciating the leaders of this. We are appreciating maybe the Yaloja, Vavaloja, because it shows that they are not only in charge, they are in control of the place.
Lagos State Commissioner of Police, Imo State, assessing the level of compliance with the restriction orders in Lagos. Now, let's drill down a little bit on that and talk to Dr. Dolapo Fashawe, the General Manager of the Lagos State Environmental Protection Agency, LASEPA. Good evening, Dr. Fashawe. Thank you so much for your time. Let me begin straight away by asking you, what's your assessment of the compliance level generally? We just heard from the Lagos State Commissioner of Police. What's your own assessment?
Well, good evening, and thank you very much for having me on. We have been working closely with the police arm. We've been working with the Commissioner of Police. We have a team out there. Honestly, compliance with the middle socioeconomic class has been very good. but we find a high level of non-compliance. With, the further away you go from VI, Ikoyi, Ikeja, the more difficult it is. And if you want me to generalize, there's awareness, but there's very high level of non-compliance, mostly from small event centers and religious houses in the interiors of the state. It's quite poor.
I'm sorry to cut in, but can I ask you if that is a question of sensitization or awareness? Could it be that this information has not yet percolated down to those levels?
So I beg to disagree. Most times when we go on awareness drives, we take along with us handbills that show what social distancing means. And a lot of them I've heard. For some reason, they do believe that gathering together to pray together will get rid of the disease. So it is not a situation of awareness. The Lagos State Ministry of Health and Lagos State government has done a lot of advocacy through all the media. We have even reached out to the grassroots through political routes. Yes, there's awareness. I can say that for sure.
Now, that would then bring one to the next step, which would be enforcement, because this is in the public interest. You're talking about public health and public safety here. And so if you've identified that these particular groups seem to have low compliance levels, what is going to now happen in terms of enforcement of this to ensure that the objective for which this was put in place is achieved?
Okay, the thing is, we have update meetings, and at these meetings, we share statistics and data. So what it is already is we are looking forward to Friday and Saturday, and especially Sunday morning, to double our efforts with statistics as to area of compliance. Areas of low compliance, we're doubling our enforcement teams. And at this time, we're even asking for volunteers. You can help us maintain enforcement in your own little circles. Go out when you see aggregation of people that are more than 20. Wear your face mask to protect yourself. Stand at a safe distance. And then break it up or call the numbers that will be flashed on TV right now. Yes, we working, albeit scientifically. We've noticed that religious institutions, industrial sector, and social, the social environments are the most non-compliant. Very the telco sector. They are working. We are happy with the bank. They are working, but they are offering minimal service with information technology backing them up. We've not had to see any bank. No bank has had the stipulated amount in there, even though they are called essential services. The telecommunication industry has been very cooperative. And the academia, schools, and even distribution companies are quite cooperative. So we look forward to more advocacy with geo and industrial sector.
Thank you very much, Dr. Fashawe. We've completely run out of time for this segment. We do hope, as you say, that as you look forward to Friday and Saturday, that the compliance levels, and indeed Sunday morning, the compliance levels will improve. Dr. Dolapo Fashawe is the General Manager of LASEPA. We'll take a break. When we return, amongst others, we'll go to Owerri in Imo State to check on what's happening there with regards to this COVID-19.
COVID-19 is a new strain that has not been previously identified in humans. The incubation period for COVID-19 is between 1 to 14 days, most commonly around 5 days. Common signs of infection are cough, respiratory symptoms, fever, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Here are some basic protective measures against COVID-19. Frequently wash your hands with soap and water for up to 20 seconds. In the absence of soap and water, thoroughly clean your hands with an alcohol-based hand sanitizer. Maintain social distancing, at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. Practice respiratory hygiene. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Avoid touching your eyes, nose, and mouth. Greet people with a wave, a nod, or a bow. If you do have a fever, cough, and difficulty breathing, seek medical attention immediately. In case of an emergency, you can call the NCDC toll-free number 0800 970 00010. Lagos State Emergency Hotlines 08000 Corona, 080-231-69485, 080-335-65529, and 080-528-1724.
Thanks for staying tuned. Welcome back to the special on COVID-19 and what is happening on that level right across the country and, in fact, outside our country. Before we go to our correspondent, Tokwe Kutei in Owerri, the Imo State capital, let's bring you something from the aviation sector and how that is being impacted by this. State-owned Ibom Air is joining the list of domestic carriers suspending domestic flight operations in the face of the COVID-19 pandemic. A visit to 2 of the domestic terminals in Lagos showed little activity as the airlines and airports appear to be adjusting to an eventual shutdown. Our aviation correspondent, Bukola Joe Kitumbi, has that report.
It's a bit quiet on the outside, but a few passengers are present at Aero Contractors' counter. Dana Airlines' counter is conspicuously empty as it has already temporarily suspended flights. The Murtala Mohammed Airport 2 in Lagos appears to be gearing up as almost all domestic airlines in the country will wind down their operations by Friday, the 27th of March. State-owned Ibom Air has also announced that it will suspend operations on Sunday, the 29th of March, 2020. Authorities here say there have been 11 departures and 8 arrivals, and we catch a few passengers exiting the arrival area. One of the passengers believes shortening the domestic operations is important to curbing the spread of COVID-19.
We just have to cooperate with the government and every other authority that is put in place to make sure the disease is not spread more than what we have, so that we can handle it and get those affected treated and life will return normal.
At the General Aviation Terminal, activities are low at this time. This is where Arik and Airpeace operate most of their flights. Although there are few passengers before one of the counters, many workers here say they anticipate a total lull as well as job vacations when the 2 major airlines close temporarily tomorrow. Bukola Joe Oketumbi, Channels Television News.
And from the 2 domestic terminals in Lagos, the nation's commercial capital, we go east now, the southeast to be specific, to Owerri, the Imo State capital, where Tokwe Kutei is standing by to give us an update. Good evening, Tokwe.
Good evening and welcome to Owerri, the Imo State capital. As the Imo State government continues to put all measures in place to ensure that the coronavirus COVID-19 does not find its way into Imo State, the Imo State Police Command says it will begin the enforcement of all directives and orders given by the state government to the people of the state on the prevention of the coronavirus in Imo State. This was disclosed by the Police Public Relations Officer Orlando Ikoku while briefing journalists in his office this afternoon. He says in addition to the shutting down of all educational institutions, nightclubs, late-night restaurants and pubs, the police will enforce the directive of the state government in shutting down all major markets across the state, which will take effect from Friday, the 27th March 2020. Even though the market leaders were in Government House this afternoon to appeal to the governor to extend the shutting down till 29th March, Sunday 29th March 2020, which the governor agreed.
We are going to go full blast to enforce it. In that instance, we might not be arresting, but we will use all possible means to disperse anybody that is seen gathering. I want to say here that every kind of gathering, be it social, be it religious, be it whatever, is banned in Imo for now. So everybody is directed to be indoors so that together we can be able to fight this pandemic called coronavirus.
We'll continue to keep you up to speed with events and happenings around here in relation to COVID-19. It's back to you in Lagos.
Thank you very much, Itokwe Kute, reporting there from Owerri, the Imo State capital. Well, now I'm being joined on the program by Dr. Yetunde Oyalowo, who is a public health physician. Doc, welcome.
Thank you.
Launching straight into it. Yesterday, we were talking about this social distancing and this avoidance of gatherings. How have you assessed, from your own perspective, how have you assessed the level of compliance, or maybe first the level of understanding of this concept and how vital it is to combating this?
Thank you. Social distancing is vital to combating this pandemic that we found ourselves in. But looking at the lower segment of the society, the communities, the informal sector, we will see that social distancing is not really fully understood by this segment. And it speaks to other parts of our existence as a nation. It speaks to the fact that education, because health cannot stand alone, education, food security, housing, all of those three, you need to consider them even when you want to talk about social distancing. Someone who lives in a one-bedroom apartment, how does he do that? You know, someone who has to live day to day on income on a daily basis, how does he do that? So it actually speaks to other aspects of our existence as a country, and to people who are in the informal sector, who are in the lower segment. They do not understand the scientific basis, and even if they understand, there is a drive for them to survive. So it's a survival instinct, and that's why we're still finding them where we're finding them.
Now, there is that on one hand, and now from what we understand, the federal government is considering introducing an interstate travel ban, which means that other sectors, which you have not mentioned, for example, the transport unions and so on, will now be affected by that, because if there's no interstate travel, that's an entire sector that will be affected. But that is only part of what will eventually be what some are describing as the lockdown. Some of those I've spoken to, and they are physicians as well, say that until we get to that, we still may not be addressed. And they give examples of other countries that are battling this, that if we don't get to that and get to it quickly, we won't. I mean, just as we were starting this program this evening, the news came that we've got 14 new cases today. So the numbers are slowly rising. Someone pointed out about a week ago, we still had only one case, just over a week ago. And now we're talking about 65 cases. So how vital, I mean, again, are these other measures that are being put in place, and how vital is it that this is communicated?
Okay, with the numbers rising, I think for people to also understand fully, they need to know the total number of people that have been tested. Because if you're just hearing the numbers, the number of confirmed cases, you can assume that maybe just 80 people were tested, or just 100 people were tested, and we're getting 61. But if you know the total number that is being tested, and you're seeing how it is rising, I think it will also help people to put into cognizance why the rate at which the numbers are rising. Now, getting to the total lockdown, we have to do it. But we need to consider our habitats. Is it going to be fully possible, even with enforcement? You can get to some parts you can move interstate without passing through the regular express. You know, so how are we going to enforce it? Well, that's for the government to do, but we need to get to a point where people fully understand and they can actually do what they're supposed to. They have to take responsibility and do what they're supposed to do. And I think we need to still get into the communities. We need to educate them more. We need to have champions in the community telling people and showing them that this is true. This is not a case of a disease that is only for the high and mighty. This can get to anywhere. We also need to look at the way we are disposing our refuse. A lot of people are putting, we're sneezing, we're coughing into tissue papers, we're disposing it anyhow. People are carrying the waste. Are they well equipped? Do they have PPE? Because that is also another route of transmission. So we have to look at it only, call for help if we need it, get volunteers, get people to really go into the communities, whichever way we're going to do it, to achieve social distancing, because we know that is the only way we can flatten the curve.
Now, sometimes, again, we're getting some level of mixed messaging. If you go online sometimes, or if you read the newspapers and so on, you get mixed messaging. What do I mean by that? There are those, for example, who talk about face masks not being really of help if you are not suspicious that you have it already, or if you are not a confirmed case. That so wearing face masks may actually deny, and because of the shortage of those, you may actually deny somebody who really is in need of this, of that. Now, I just take that as an example. Now, if we are to look at it, what could you tell our viewers, about what are the preventive measures? What are the things to be done? What can they do to keep themselves safe, apart from the social distancing that we've talked about?
We cannot overflog the importance of hand washing. It's the single most important thing to do. But we also need to get in the message that the technique of washing hands is very important. You must wash it for a particular length of time. WHO is saying 40 to 60 seconds, saying that if you sing the happy birthday song twice, you can achieve that. So people need to understand that technique. We need to be able to wash all the different parts of the hand, just as we've been seeing in posters. When it comes to the use of sanitizer, the technique has to be proper. That means there's a whole lot of sanitizers all around. It has to have 70% of alcohol before you can achieve what you can do.
Okay.
You have to actually have the same a good quantity. That is, some people have been carrying 50 mils around for 2 weeks, which means they're not actually using the right quantity. You have to have the right quantity. You have to rub it in for 20 seconds, and you have to allow it to dry to achieve the disinfection you're looking for. So we have to getting the techniques right, even for the messages that we're passing across.
What you said now about the hand washing and about the content, because everybody is going after hand sanitizers, a number of new manufacturers have come into the market with sanitizers and other such. So what you're saying is very important. We'll get back to that in just a moment, so please stay with us, Dr. Oyalowo, because we also want to take a look at some other measures from some other states and some other countries about what they've been doing in order to ensure that we go over this. Now, just staying in the country, just for a second or two, as part of efforts to contain the spread of this pandemic in Delta State, the state government has ordered the shutdown of the Asaba International Airport to traffic and the closure of all land borders in and out of the state. All land borders are to be closed from Sunday, the 29th of March, and business malls, supermarkets, and shops will shut down from Wednesday, April the 1st. In Kaduna State, the government has announced a 24-hour curfew till further notice. The state deputy governor, Hadiza Balarabe, said during a state broadcast that beginning at midnight of today, residents are ordered to stay inside their homes. She explained that the decision to impose the curfew is due to the unsatisfactory compliance rate with the ban on commercial motorcycle and tricycle operators, as well as the restriction on large gatherings by a large section of the residents. The deputy governor also warns that during the period, no offices, businesses, or places of worship will be allowed to open, while the curfew will be strictly enforced by the security agents. Now, taking a look, before we go outside, let's take a look at some of the data that we have at the moment. Data from Johns Hopkins University shows that the number of reported infections around the world has now surpassed 500,000, that is 500,000. It also shows that more than 22,000 people have died, and countries continue with restrictions to help curb the spread of the pandemic. In Kenya, East Africa's biggest economy, President Uhuru Kenyatta has announced a nighttime curfew from Friday, that's tomorrow, and taking an 80% pay cut to provide funds for fighting the pandemic, while asking other members of government to do the same. But the focus really is on Italy, where a total of 712 people have died from the virus today. bringing the death total in that country to 8,215. Most of the figures coming from the southern part of the country, despite of signs that suggest spread of COVID-19 is slowing at the epicenter. Spain has a total of 4,089 deaths with 56,188 confirmed cases. 578 people have died in the UK after 11,658 people tested positive for the virus. The country's chancellor today announced a £2,500 a month grant to help self-employed workers deal with the financial impact of the virus. In the United States, New York Governor Andrew Cuomo says he's disappointed with the $2 trillion aid bill passed by the U.S. Senate on Wednesday. The state remains the epicenter of the outbreak in the United States with 37,258 cases of COVID-19 so far. Now, if we take a look at the website there it is, the World Health Organization, you can in fact see some of the figures there. Yes, much better. You can see that the figures you have there include those from several countries, and then a grand total is also there. This is, of course, the website live as it is today. 462,000 as at the time, 462,684 confirmed cases, more than 20,800 confirmed deaths, and now more than 200 countries affected, basically now everywhere across the globe. This is what is happening right across. Now, infection rates, that's what we have from the WHO at the moment. But back to the figures and what's happening right across, infection rates in Africa are still low, though, compared to the rest of the world, with 2,700 virus cases in just 46 countries. That's 46 out of 54 countries. But there are fears that the number on the continent will rise rapidly because of cross-infections, overwhelming health services. So it's no surprise that officials are taking no chances by stepping up efforts to prevent the spread of the virus. In East Africa, Uganda has moved to its highest alert level, imposing self-isolation with all non-essential services, schools and offices to be shut to help efforts to stem the spread. Police with guns and sticks, we're seeing today, enforcing a new 2-week ban on public transport and forcefully shutting businesses. Gunfire rang out in one street in the capital of Kampala as officers chased people and roughed up suspects accused of defying the president's orders. The country has confirmed 5 more cases of COVID-19 yesterday, bringing its tally to 14, 4 days after it recorded its first patient.
You have created a second window of opportunity. The question is, how will you use it? There are 6 key actions that we recommend. First, expand, train, and deploy your healthcare and public health workforce. And second, implement a system to find every suspected case at community level. Third, ramp up production capacity and availability of testing. Fourth, identify, adapt, and equip facilities you will use to treat and isolate patients. Fifth, develop a clear plan and process to quarantine contacts. And finally, number 6, refocus the whole of government on suppressing and controlling COVID-19.
And that's the Director General of the WHO, of course, talking about 6 measures that he expects that countries who are battling this will focus on in an attempt to bring it to closure. Well, let's go to Atlanta, Georgia, where Dr. Iho Ofotokun, Professor of Medicine and Senior Physician at Emory University School of Medicine, joins us via Skype. Good evening, Prof. How are you this day?
Good evening. The day's been very busy, but we're hanging in there.
Now, let me come to the particular situation of where you are in the United States. We read of, a rapidly increasing caseload and fatalities as well. What would you put this down to in terms of reasons?
Well, so we have to understand the virus itself. The reason why the virus is spreading so rapidly is because it's a highly infectious virus. So those of us who are infectious diseases experts describe the infectivity of a pathogen such as this virus by the acronym ROLL, which is the number of individuals that can be infected by a virus from an index case. So in this case, the role for the coronavirus is about 2 to 3. So every individual person, an index case, can infect an additional 3 individuals. And those 3 individuals will then in turn infect other 3 individuals. So the circle continues to spread. And that is why we are seeing a widespread of this virus across various communities in the globe, because this virus is very highly infectious.
Now, there are those who, when this broke out, there were those who talked about the fact that they looked to countries like the US, where you have fairly well-developed and quite effective healthcare systems to be quite prepared to tackle this. But it turned out that that wasn't quite the case this time, with reports about test kits not being available and some of the equipment not being ready for deployment and all of that. Now, has that been overcome now? What's the situation? What's the status report right now about those?
Well, things are improving. Test kits are becoming widely available, and many health institutions are able to develop their homegrown test kits. So as part of this week, we have a wide availability of test kits, and that is one of the reasons you're seeing the number rising. So we are now able to test and identify infected individuals.
Now, looking at this situation from where you stand, what is the situation with the pressure on healthcare professionals? Because that seems to be yet another issue. Some people are having to be called out of retirement.
Yes, it's a major issue, and the encouragement is that to Nigeria is that they should do everything possible to make sure that this infection is contained. I have been on call every day for the past 11 days in the hospital taking care of patients, some of them infected with COVID-19. A number of my colleagues have been, especially those in infectious diseases, have been engaged. And so round the clock since the outbreak of this epidemic here in the US in January, it's been a tremendous demand on every one of us healthcare workers, but doctors, nurses, and all the people that work within the healthcare setting. So we're working really hard to ensure that we can flatten the curve, and that is why we are encouraging people to socially distance. We're encouraging people to stay home. As you may have been mentioned in your previous discussion, the incubation period of this virus is anywhere between 5 to 10 days on the average, up to 14 days in some cases. So our hope is that if we can keep an entire community locked down or encourage people to stay socially distanced in their homes, within a period of 14 days, most people that have infection or that are carrying the infection would have cleared their infection, in which case they will be safer to get into the community.
Dr. Igor Ofotoko, Professor of Medicine at the Emory University in Atlanta, Georgia. Thank you so much for joining us on this special COVID-19 program. Thank you so much for joining us.
Thank you.
We'll take a break, and when we come back, we'll have our final moments with Dr. Oyalowo, who is still with me here in the studio. So please stay with us.
Coronaviruses are a large family of viruses that cause illness, ranging from the common cold to more severe diseases. The current outbreak, COVID-19, is a new strain that has not been previously identified in humans. The incubation period for COVID-19 is between 1 to 14 days, most commonly around 5 days. Common signs of infection are cough, respiratory symptoms, fever, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Here are some basic protective measures against COVID-19. Frequently wash your hands with soap and water for up to 20 seconds. In the absence of soap and water, thoroughly clean your hands with an alcohol-based hand sanitizer. Maintain social distancing, at least 1 meter or 3 feet distance between yourself and anyone who is coughing or sneezing. Practice respiratory hygiene. Cover your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose of the used tissue immediately. Avoid touching your eyes, nose, and mouth. Greet people with a wave, a nod, or a bow. If you do have a fever, cough, and difficulty breathing, seek medical attention immediately. In case of an emergency, you can call the NCDC toll-free number 0800 970 00010. Lagos State Emergency Hotlines 08000 Corona, 080-231 69485, 080-335 65529, and 080-528 17243.
Welcome back. Before we go to the promised closing moments with Dr. Yalowo, let's take a short trip to Bauchi, where, of course, as you've probably heard, there's been a second case of COVID-19. Actually, I'm being made to understand that it's Nasarawa we're going, not Bauchi, where Halima Gayam is standing by to give us an update. Halima, good evening.
Welcome to Nasarawa State. With cases of the coronavirus recorded in Nigeria's capital, Abuja, and owing to its proximity to Nasarawa State, the government, after days of deliberations, have declared its position to contain the spread of the virus to the state. Just this evening, the government has suspended all social gatherings, now only limited to family members of not more than 20 persons. All motor parks in the state and local government areas are to be collapsed into a single one in each of them, with medical personnel to be situated there to administer necessary medical checks on passengers. Worship centers from now henceforth are to be closed down until further notice. Markets as well are to be closed too, except for those providing essential services. Isolation centers are now to be situated at the Dalhatu Arab Specialist Hospital in Lafia, the Federal Medical Center in Kefi, and 5 general hospitals across the local government areas. Owing to the impact of the pandemic disease on the state economy, the government has announced a 60% slash on its budget and expenditure. Just as schools, all schools in the state, have been shut down for 1 month, the State House of Assembly for 2 weeks, the courts until further notice. The state government said it is not unaware of the impact of all these measures on the people, but insists it is in their interest. As at this time, results of the governor, the deputy governor, and one of the suspected case are still being awaited. From Lafia, the Nasarawa state capital, Halima Gayam.
All right, thank you very much, Halima, speaking there from Lafia in Nasarawa State. Now, our final moments, Dr. Yalowo. Of course, you've heard all this. We went to Owerri, just came back from Lafia, and then you listened to the good doctor from Atlanta, Georgia, as well as the other things that are happening in Asaba and a number of other places. Do you have confidence that all these measures being introduced at the various state levels, in varying numbers really, but all these measures put together will push us on the path, especially given the fact that we are witnessing a rise now in the number of cases?
We have to stay positive. And I believe that all these measures will do good eventually, especially in states where they've not had any case. They will be able to stay without importing the cases to the states. And for those that have cases, if we can actually take responsibility, adhere to the rules, and support the government with all the measures that we've been told to do, I want to stay positive that we'll get there.
The final question I wanted to ask you before rounding this up, and maybe you'd give me a quick answer, is, are you confident in the kind of care and concern that is being expressed for medical personnel in particular who are in the forefront of this?
I'm not in the forefront of this, but I want to say that the medical personnel who are in the forefront, the reports we're hearing is that they're fully donned in their PPE. So nobody is, their safety is being put first above any other thing. And I think that is why they're still in the field. That's why they're still working. So I'm confident that the government, being responsible, will take care of the safety of the healthcare workers that are in the front line and they're fighting COVID-19.
Dr. Yetunde Oyalawo, thank you so much for your time tonight.
Thank you.
Thank you so much for joining us. And that's where we will end tonight's special program on COVID-19. We want to thank you so much for joining us. My name is Ladi Akeredoluale.